Jeffrey Klausner is a professor of medicine and public health at the University of California in Los Angeles, and he joins us now. Now, Jeffrey, passengers, as we said, are going to begin to disembark from the Diamond Princess. Just walk us through what the passengers will go through once they've come off the ship.
Well, once they come off the ship, the passengers will be assessed for any signs of infection or illness. So the most common symptoms are cough and fever. So they'll be assessed 2 or 3 times a day, have their temperature taken, be monitored for any cough, and then with some frequency, either every day or every other day, they'll be monitored with swab tests for the presence of the virus.
So we're assuming that they're going to continue to be quarantined either in the vessel or outside when they disembark, after they disembark.
Yeah, so the current plan and the current control strategy is to find new cases, to isolate those cases and put them in a place where they cannot infect others, and then anyone who's been exposed to put them in quarantine for a 14-day period and demonstrate that they've not acquired infection.
Now, Jeffrey, we are seeing the number of cases in China drop, but does this mean the epidemic is coming to an end, or are we still far from that?
Well, I think we should be optimistic, and I think with most epidemics, they do tend to go down naturally, and that's due to the what we call the exhaustion of susceptibles, or there are no more individuals in the community who can get a new infection. So we see epidemics start, they go up, and they go down. And additionally, the very few number of cases outside of China should also be reassuring that the epidemic will go down in size.
Bring us up to date in regards to the vaccines that are being prepared to combat the COVID-19. The last we heard was from UK scientists that they said that they found a cure to the virus.
Well, in terms of the medical research, there is kind of 3 areas of main research right now. I mean, one is to develop a vaccine. We know that people who clear the infection on their own, they have antibodies in their blood, and those antibodies protect them from getting new infection. So that's essentially what a vaccine would do. They would create natural antibodies that would then protect people from getting infection. But the vaccine development pathway can take several years. So I think the earliest we would see a vaccine commercially available would be 1 to 2 years from now. However, there are antiviral medications. So there were antiviral medications that were originally developed to treat HIV infection, and those same antiviral infections have been shown to be effective for this coronavirus.
All right, thank you so much for that analysis. That's Jeffrey Klausner, the professor of medicine and public health at the University of California in Los Angeles.